Hi, this is Daniel DiTuro. Are you considering a continuous glucose monitor based on print or television advertisements? In this video, I'll share what is a continuous glucose monitor. Is a continuous glucose monitor continuous? Do CGMs eliminate finger sticks? Who can use a CGM? Do CGMs reduce your A1C? And CGM contraindications. A continuous glucose monitor is a medical device worn to measure skin glucose levels. CGMs do not measure blood glucose. You need a prescription to buy or lease a CGM. Medically necessary CGMs may be covered by insurance, including Medicare. Medically necessary usually means people with insulin-dependent type 1 diabetes. The CGM may be used with an insulin pump. There are two types of CGMs, personal and professional. The patient buys and owns a personal CGM. Professional CGMs are owned by the healthcare provider and usually loaned out for 1 to 2 weeks. Professional CGMs are used short-term, so your provider can monitor your glucose levels. A CGM consists of two parts: the data sensor transmitter attached to an arm or abdomen, and a receiver recorder. The data can be downloaded to a computer or smartphone app. Depending on the model, the sensor must be replaced every 3 to 7 days. Unlike blood glucose meters that measure blood glucose, CGMs measure skin glucose levels. It measures glucose in fluid between skin cells. There's about a 15-minute lag time between skin and blood glucose levels. An alarm sounds when blood glucose measurements are too low or high. Many CGMs allow you to note your meals, physical activities, and medications. Contrary to its name, a continuous glucose monitor does not monitor glucose continuously. Most CGMs record glucose levels every 5 to 15 minutes, 24 hours a day. That's between 96 to 288 measurements a day. Significantly more measurements compared to finger sticks. A major advertising myth is that a CGM eliminates finger sticks. Currently, only one FDA-approved CGM does not require checking blood glucose before taking insulin or treating low blood sugar. All other CGMs require measuring blood glucose using a finger stick before treatment. Also, a CGM may need to be checked twice a day using blood glucose measurements to confirm its measurements are accurate. Your doctor may recommend using a CGM only a few days or weeks. Using a CGM for a few weeks does not eliminate finger sticks. CGMs are primarily used by people with type 1 insulin-dependent diabetes. Research studies are underway to learn if a CGM can help people with type 2 diabetes. Your doctor determines if a CGM is beneficial for your health. Some companies marketing fad diets and dietary supplements promote CGM use for non-diabetics. They claim a CGM will help monitor how food and exercise affect blood sugar. CGMs do not measure blood sugar. They measure intercellular sugar. A CGM may be beneficial for a woman with a family history of gestational diabetes, or pregnant women who are overweight, obese, or have insulin resistance. Most healthy people with no family history of diabetes and normal A1C or blood glucose do not need a CGM. Diet websites selling CGMs conveniently have medical providers on staff to write a prescription. These websites conveniently omit the fact that most insurance companies do not cover the cost. Some CGM ads claim they are proven to reduce blood A1C. A1C, also known as glycated hemoglobin A1C, is a type of hemoglobin that bonds to blood sugar. A1C for a person without diabetes is less than 5.7%. A person with an A1C of 6.5% or higher is classified as a diabetic. Ads claiming a CGM are proven to lower A1C are a bit misleading. A1C is used to measure blood sugar for people at risk of developing type 2 diabetes, not type 1. Most A1C CGM studies are observational or based on meta-analyses, not on double-blind clinical trials. The people in CGM studies had an A1C ranging from 8% to 12%. A1C was reduced about 1.5 plus or minus 2.2%. Most people with type 2 diabetes can lower their A1C without a CGM. It can be done by regular exercise, reducing added sugars, taking medications as prescribed, managing stress, eating to prevent high and low blood sugar levels, restricting alcohol consumption, and regularly checking blood glucose numbers. A continuous glucose monitor is not for everyone. People with severe hypo or hyperglycemia should not use a CGM. Also, anyone with diabetic ketoacidosis until their blood glucose is within the CGM's measurement range. The sensor must be removed for CT and MRI scans. The CGM sensor is held in place with an adhesive. People with sensitive skin can develop a rash and itching. Installing the sensor in different locations may prevent a skin rash. The sensor must be replaced every 3 to 7 days. Installing and wearing the sensor can cause pain or discomfort. Before calling the phone number in an ad, talk to your doctor about the benefits and risks of a CGM. Please leave a comment if you have any questions about this video. Thank you for watching.